Good afternoon, Dr. Zheng. Thanks for the interview. To start with, you majored in Chinese medicine in Nanjing University of Traditional Chinese Medicine. What made you come to RMIT Australia?
Right, I come to Australia in 1995. I come here to do a degree, a PhD at Melbourne University. The reason I wanted to come here was in China we use acupuncture for stroke rehabilitation, and that was widely practiced in the hospital for inpatients. At that time I noticed what acupuncture can do, and I was wondering, people in the countries where they don't have acupuncture, what method would they use to help stroke patients to recover? So then I discovered physiotherapy. I thought, wow, that would be something interesting, something I would like to learn. So I decided to come to Australia my main reason to come to Australia to study physio. But Melbourne University gave me the scholarship, and to come here, then I realized my scholarship was research. So instead I did research instead of studying physiotherapy. So and when doing research at that time, the School of Physiotherapy at Melbourne University didn't have much stroke research, so they did have pain research. So instead I did pain research. That's how I came to Australia. And after my graduation from PhD, and then I joined RMIT to come here to teach. Yeah.
So, what are the advantages of researching Chinese medicine in Australia compared to China?
Obviously when you do research, when you do anything in different countries, there are advantages and disadvantages. Okay. So you asked me about advantages. I think maybe the advantages are more about the language, because here we speak English and everything's English, so that makes it easier for us to publish papers in English journals. That would be one thing. But also here we're very multidisciplinary. Like in our school, we have chiro, we have chiropractic, we have osteopathy, we have nursing, we have psychology. And when I did my PhD, I was working with physiotherapists, psychologists, and neurologists. So it's kind of very multidisciplinary, and allowed me to access knowledge and expertise from other disciplines. And so here we do more collaborative research. So in that way, I think another advantage is to be able to do collaborative research with other disciplines more easily. That's what I think.
Could you tell us about the disadvantages as well?
Obviously there are disadvantages, because Chinese medicine is complementary medicine here. It's not mainstream. And when you do clinical research, subject recruitment would be always a challenge. Because in Australia we don't have hospitals for Chinese medicine. The way we recruit in patients would be mainly from the public and from Western medicine hospitals. And how many people in Western medicine hospitals, patients, might be interested in Chinese medicine trials, that's I think that number would be reduced. But having said, it could be an advantage as well. People in Australia and in Western countries have more altruism, so that means they're more likely to volunteer for something, for a better cause, not necessarily for their own cause, for a better cause. So yes, so that in some ways also an advantage.
One of your areas of research interest is identifying the role of acupuncture in the management of pain.
Yeah.
So could you tell us about some of major achievements in this area?
So major achievements, and thank you. I think when I come to Australia and did research in pain, that's what my pain PhD was about, I sort of realized the advantages of what acupuncture can do for pain management. But my knowledge about pain management have also been expanded, and realize when we're talking about pain management, it's not just about relieving pain, because pain is multifactorial. There are many psychological influence, social influence, and we also learned centralization and peripheral sensitization. Your nervous system changes as a result of pain. So all of this let me realize, and that's acupuncture, in order to better utilizing acupuncture for pain management, it's important we identify what acupuncture can do and cannot do. And so that's why my research area has been focused on the role of acupuncture in pain management, not just acupuncture for pain. As you can see in a lot of clinical trials coming out, acupuncture was not better than sham acupuncture. They all reduce pain, but they're not better in sham acupuncture, in particular in chronic pain. So why? So obviously, maybe this is related to we're not selecting patients as much as we can. We're not knowing which particular condition responds to acupuncture really well. We don't know who responds to acupuncture better than others. So that's the research area we are undertaking. I can't say major achievement, but what we have identified recently is we developed a model to be able to identify people who are adaptive to pain and people who are non-adaptive to pain. So if you give a strong pain stimulation, some people, their pain would increase and reduce, while other people would increase and stay high. So we call the pain reduced people pain adaptive people, and pain not reduced people pain non-adaptive people. Then we give them real acupuncture and sham acupuncture. We actually find them they will respond to acupuncture differently. So that's one of the areas to say who will be the respondent to acupuncture. And we try to looking at adaptability and endogenous pain control, and to looking at who might be a better responder to acupuncture. And we're also looking at the multi-complexity part about pain, and because pain not only have pain, they might have anxiety, depression, fatigue, physical impairments. So we try to understand which area of that acupuncture are more effective in doing so. Yes.
Okay. So what research methods do you use to assess the effect of Chinese medicine? In what way are they effective in evaluating those effects?
Yeah. We obviously adopt standards ways to assessing the efficacy and the effectiveness of acupuncture, like we use in systematic reviews and randomized clinical trials. So most trials we do are sham acupuncture control, so we're able to looking at efficacy. But we're also doing the trials where no sham acupuncture active control, so there's more like pragmatic trials. These are the standard methods we use, but we're also using other methods, which for psychophysics. And psychophysics is not exactly clinical trials, it's more like using kind of measurements to identify what areas of pain will be more responsive to acupuncture. So psychophysics would, like say if I'm measuring your pain threshold, if I give you pressure on a certain part of your body, and I increase the pressure to a degree, say, oh yeah, that's painful, and that's your pain threshold. If I continue to increase this pressure and you say, oh, it's so painful, I can't really tolerate anymore, and that becomes pain tolerant, confidence threshold. So these kind of methods we call psychophysics. The good part of using this method is it's very well controlled. So I might deliver exactly the same amount of pressure on you or on me, we will feel different. And the problem with clinical pain is you don't always know how much injury you have, whether your injury is comparable to my injury, and that makes it difficult to quantify pain. But here with this one, we know exactly the amount of stimulation we get, and then if we report pain differently, and that just means two of us are reporting pain differently because we've been given exactly the same amount of stimulation. So that's a similar kind of thing. So we use psychophysics as well, the methods. In that, this is just a pain threshold is just the most simple example. But psychophysics would allow us to assess the mechanisms. We're able to looking at whether the effect of acupuncture was more peripheral related or central related. So with the most targeted modified central nervous system or more peripheral. And our previous research really showing acupuncture effect for pain is probably very segmental. So it means if we put the needle on the leg, say to stomach 36, and you're more likely to increase the pain threshold on this leg, on the opposite leg at a similar area. So this because they are innervated by same spinal nerve. Yeah. So that's more segmental effect. So acupuncture probably have more segmental effect in our previous study in healthy humans. But in recent years, this research we just been accepted by European Journal of Pain in our systematic review. We also found really needling local points, local archer points, is better than needling distal points for chronic pain. So this seems consistent with what we've seen before. To say acupuncture result probably very segmental. So this kind of studies allowed us to looking at. So we do a combination, a mix of psychophysics studies, and clinical trials and systematic reviews.
Basically everything.
It's kind of systematic review and clinical trials allowed us to assess efficacy and effectiveness, while psychophysics tests allowed us to looking at the mechanisms at the same time. And which I think we should look into that. Not only looking at mechanisms, but also allowed us to target what kind of pain acupuncture is really good at, centrally mediated or locally mediated. In this case, if acupuncture more segmental effect, you have to say there's more local effect. And also who is going to be a responder to acupuncture for pain.
So, as the founder, founder and the current editor-in-chief of Australian Journal of Acupuncture and Chinese Medicine, what are your future visions and plans in this?
For this journal?
Yeah.
I was the founder. The Australian Journal of Acupuncture and Chinese Medicine was founded in 2006, so it's nearly 9 years now. I was the editor-in-chief, but I'm actually resigning from this role after so many years. The journal was created to provide a platform for Australian educators, researchers and students in Chinese medicine area to publish their research. So our vision is using this as a way to improve people's research capability and to encourage students, educators and researchers and practitioners to publish their findings and to sort of more improve this academic discussion, intellectual exchange. I think we are achieving that. We have a lot more Australian writers now and submitting to us, and our authors do range from practitioners to academics to sometimes students as well. So that is the role of this journal. Hopefully continue in that form. and maybe continue that or maybe become more regional. Yeah, because that's really, there's nothing much about Chinese medicine in Australia in terms of publication journal-wise. Yeah, peer-reviewed journal is a peer-reviewed journal. We follow very strict peer review guidelines and things like that. Yeah.
So for the last question,
Yes.
Is there any international students in your research lab? Like what?
Yes.
What qualifications are required for, like maybe say Korean students who are interested in
studying more? So our lab is more clinical research.
Oh.
And so we do more clinical research.
In acupuncture?
Yeah. In acupuncture and in other pharmaceutical intervention. Basically, because we are focused on Chinese medicine research, so anyone who's coming from Chinese medicine background with a bachelor degree, they can come to study with us. Preferably, we would like someone who have research background or have some research experience, so they are able to come and do research with us. Doing research in Australia is quite different from doing research, say, in China. I'm not familiar with Korean system. In Australia, doing research, there's no coursework, very little coursework. So people basically come in, develop a project with supervisor, and then carry out the project. So all the learning mostly through you doing things, not through you sitting in the classroom passing exam. There's very little exams, very few exams, there's probably no exams, only a couple of subjects for to learn what's the research method and mathematics and statistics, more statistics, and the clinical design, clinical research design. And then most time you're actually doing your own project. You learn by doing it. I think it's best way of learning. So the requirement for students will be published journal articles. We want to publish at least 3 during their candidature. At least, yes. We probably don't know how many in your university, probably more. And obviously at the end they have to have a thesis to submit as well. But yeah, so Korean students are most welcome. We had Korean here before.
Oh, really?
Yeah. And we do have quite a number of international students. We also have local students studying.
Local students and international, everyone's in.
Yeah.
Oh, okay.
Yeah. So anyone who have a Chinese medicine background or even medicine background, if they want to study themselves. Yeah.
Thank you. Thank you so much for the interview and opportunity. This will be a great help to students and scholars in Korea.
Thank you. I appreciate the opportunity. All the best to your study and the research, and to the Korean Chinese medicine researchers and educators.
Thank you.